For months now, we've been told the NHS is open for business. But for tens of thousands of patients waiting endlessly for hospital treatment, it probably doesn't feel like it. Chris Baltiel's arthritis means he's in constant, debilitating pain. He now needs crutches to walk, and his operation for a hip replacement was cancelled in March. He's no idea if or when it will happen.
At night, I lie in bed. If I wake up in the middle of the night, I'm always in pain. I'm always frightened to get up because I know that any movement is going to make the pain worse. So sometimes you lie there and you think to yourself, is it worth carrying on?
Chris isn't alone. In September, nearly 140,000 patients waited more than a year for treatment, the highest since 2008. Last year, that figure was just over 1,000. And cancer referrals have hit a record low. Almost 30,000 waited more than 2 weeks before their first appointment. Halting planned operations and routine care during the first wave of the pandemic has had a major impact.
We don't want to step down elective surgery where at all possible, and indeed that's why in the second wave this autumn we haven't done that. We are keeping elective care going. Our clinicians have done a fantastic job over the summer at beginning to catch up. Cancer work is back where it was last year. There is more work to do.
Many surgeons don't think that optimism will match the hard reality.
We're not going to really get back to normal throughput until the summer, and that's not going to make much impact because all those people will still be waiting and all the others will have been added to the waiting list. So I think we do have probably 2 or 3 years of pretty bleak times in terms of attacking the waiting lists.
Leanne doesn't have years to wait, though. She has stage 4 endometriosis as well as 3 small children. A hysterectomy could end her pain, but the procedure was cancelled in May and has just been cancelled again.
It really is heartbreaking, and it's kind of spiralled me back into depression when the endometriosis kicks in. It's like being in labour like every day. Sometimes I can't get out of bed. I can't be a mum to my children. I can't do the usual like playing about with them.
As the number of COVID patients in hospital continues to go up, the likelihood that patients like Chris and Leanne will be treated anytime soon goes down. Emily Morgan, News at 10.